So today we're going to finish out PowerPoint 1 and then do one more short little PowerPoint that I lied and told y'all we were doing yesterday. It's okay. I'm getting through this. So yesterday we talked about ICD 9 or ICD 10 or ICD 11, and I don't care whatever version you want to refer to, but ICD codes. And the D was for diagnosis. Now today we're going to talk about CPT codes, and the P is for procedures or treatments. The huge part of this unit is figuring out ICD versus CPT. And this really is a part of medicine, especially if you're going to go be a physician or some sort of medical coder. Nurses, I dealt with it a little bit, but nurse anesthetists and physicians and PAs and NPs, dear Lord, this coding is half their job. So listen up. Again, ICD from yesterday was for the diagnosis. And now if we're going to do something about that diagnosis, some sort of procedure or treatment, we also then have to code that, and that gets a CPT code. So this is a CPT book. Again, it has an index with the words and then a numerical listing. So just like the ICD, if you have the number, you can go figure out what procedure that was. Or if you have a procedure, you can find the number for that. I'm not going to make y'all watch this video. It's literally just a woman. Look, if you have ever used an index, you can figure out a CPT. For this, the good news is that you don't really have to find the main word as much, because a lot of times it'll be cross-referenced or cross-listed in certain places. So like, there's just not as many main words for procedures. So, like you had a strain of some muscle and you want to get an x-ray or something for it. Well, the procedure is x-ray. It's not as difficult. You don't have to worry about the main term as much. It does fall into 6 different sections. Don't worry about these, but just so you know, like anesthesia basically just uses this one. Surgeons will mainly use this section. Radiology is like your x-ray stuff. A lot of times evaluation and management is going to be what your normal physicians, your medical physicians do versus surgeons are doing this one. And then if they prescribe a medicine. So this is like, I don't want you to get so caught up in thinking of procedure as like it has to be some sort of surgery or test that you're doing. If the doctor just like does a 30-minute visit with you, that's an evaluation. And like that's technically a procedure or treatment. So they code for that as well. Again, so their main terms, like see that it's listed by procedure, but it's also listed by anatomical site and all sorts of different things. So it's easier to find. It doesn't require the main term quite as much. Not true. You don't have to have a main term with a CPT. Most people prefer coding CPT. Sometimes the test will ask you to find the main term for the procedure, which is weird because you usually aren't supposed to have to do that when you're finding CPT codes, but they just want you to get more practice finding main terms. It's not any different though from finding the main term in the ICD. Okay, so for instance, doctor saw you, your throat's really sore, it's all pussy on the back, and so he wants to do a strep test, specifically like a rapid strep test. So the main term, and then you're going to follow all the subterm. You look it up. So, but again, for these, a lot of times it's going to be a lot easier because I went too far. So, maybe you can look up test and find rapid strep, but also you can probably look up rapid and find strep test. So it's a lot easier to find this in the CPTs. All right. So don't think, okay, here's some practice, okay? And here's how the test questions go. Test question is, patient had a lung infection and was treated with a breathing treatment. The 2 options that make sense in the answer choices are pneumonia and breathing treatment. So of these, of pneumonia and breathing treatment, which one gets the ICD-10 and which one gets the CPT? So remember, D stands for diagnosis. Which one of these is your diagnosis? Pneumonia. So pneumonia gets the ICD-10, and then the treatment is a breathing treatment. So that's your CPT. That's your procedure. Patient underwent an excision, which means to cut something out. of a malignant lesion, this means cancerous tumor, on the trunk of their body, on their chest or back. Which one gets the ICD? Which one gets a CPT? So which one of these, between excision and malignant lesion, what's their diagnosis? The malignant lesion. So the ICD-10 would go for malignant lesion. And if you were looking it up, you'd have to look up lesion and then find the little bullet point, the subterm that said malignant. So then the CPT, the procedure we did based on that would be excision. And again, in order for insurance to pay us back, these have to make sense. So like you can't say patient's diagnosis is pneumonia, and so you code pneumonia with your ICD-10, and then your procedure was excision. Insurance is going to be like, what? That doesn't make sense. They got pneumonia. Why are you cutting things off of them? So they will go back and say, that's not an appropriate treatment. We're not paying you for it. You must have messed up. You shouldn't have done that. Very tricky one. Patient suffered a knee injury and sees a physical therapist. What's the ICD-10 code going to be? For this one, the correct answer was strain. But I don't really. This is trickier than I'm going to give y'all, I promise. Because, you know, my first thought would be, well, injury, because then knee, but they wanted you specifically to know it's a strain, which honestly isn't even a knee injury. That's a muscle injury. It should be sprain, but your curriculum is stupid. All right, for this one, again, another tricky one that I wouldn't go to this level with y'all while you're teaching this kind of to yourself. So they have that same knee injury and they see a physical therapist. What's the CPT code? So now it's not going to be this because that's a diagnosis and we get an ICD. It's not going to be this because that's a diagnosis and we get an ICD. So these are your only two procedures, and physical therapists don't splint things. They put you through range of motion exercises. So the CPT for that would be a range of motion. Again, I'm not going to have you stress out too horribly much about these. I need you to know that the ICD goes with the diagnosis and the CPT goes with the procedure or the treatment. That's how far I want y'all to get this. All right, so click on over and watch the other real short little PowerPoint. We're just gonna hit the highlights of that one.